Well, hello, everyone. Welcome in today. Thanks for joining us on Heartfelt Consciousness. My name is Michelle Young, and I'm here with Liz Daneu. And we are going to be talking about a very interesting thing that you don't hear a lot about in the yoga industry. So before we get started, I'll just give you a little bit of background about Liz. Liz is an alumni. She's been through our yoga teacher training, and she's an active and avid yoga practitioner. And she's also leading retreats. So we're going to talk a little bit about her experience with some spinal issues that required fusion. So welcome in, Liz. Thanks so much for being here.
Hi, Michelle. It's great to be here and it's great to see you.
Oh, so nice to see you too. So Liz, tell us what happened.
So I've been practicing yoga for, probably over 25 years now. And I was really robust in my personal practice and sort of, teaching in a studio, got my 500-hour moving along on my yoga career path. And I started to have what I felt initially was like hip and lower back stiffness in the morning. And it would resolve within 20 minutes of getting up and walking around. And I was like, oh, this must be that horrible arthritis thing they talk about when you get older. But I'm like, no, I eat pretty healthy and I move really well. So, I went to a spine doctor. She was at a pain management clinic, not a surgeon. But I went to her because she had done some work for me in the past with platelet-rich plasma for my shoulder. I had a pinched nerve in my shoulder and she had done my whole upper back and it worked beautifully. And I didn't even need to see a surgeon or anything like that. And I went to her and I said, I'm having this problem and it just kind of won't go away. And things that I'm doing, like vinyasas that would normally just make it go away, or dead bugs, it's not working. And she said, I don't have any imaging of your lower back. And I said, yeah, that's because I don't really have lower back problems. And I haven't. And so she took an x-ray and actually she did an x-ray and an MRI. And we discovered that I had something called anterolisthesis, which is a slipped vertebra, right? And the vertebra slips forward out of place. And most people, a lot of women who have a dance background, which I did, a lot of women get it when they're like in their adolescence and you just don't even know you have it. And I'm sure that I had mine at least since my son was born. My son is 21, because I could remember on the back when I would kind of palpate the spinous process, there'd be like a little bump. And I've had that bump forever, never had lower back pain. So she said to me, I'm not really concerned about this. You've probably had this for decades. She said, I can just see that it's angry because there's not a lot of disc there. And I said, all right, great. Well, what are we going to hit this with? Are we going to hit this with, PRP, or what are we doing here? Because I feel like, physical therapy, I'm a yogi. I have a really strong core. I teach arm balancing workshops. Like, I don't want to do that. Let's do something. So I did. I had platelet-rich plasma in September 2023 at Mass General Hospital, one of the few places in the country that will actually do the spine itself. And I really did not get any relief. And I just kind of struggled for more than a year. And, it obviously would get much better after a yoga class. I would feel like, okay, not having surgery this week, that's silly. And then it got to the point where I was actually running a retreat in July of 2024, so like 6 months ago. And I woke up one day and I turned to my best friend and I said, Monica, I have to go upstairs and do an energetic practice. That's what they asked for this morning. And I am I just can't even, I got to do it. Right. And she's like, I can't believe that. Like, you're never not excited about delivering an energetic practice. And I said, I know, I'm dreading it. And this is like in the tropics in St. Croix, I had warmth working for me. I had humidity. I had everything that makes the body feel good. And so when I got home from that retreat, I called my doctor and I said, I think I need to consult with a spine surgeon. I just want to see what's out there. And I talked to a number of surgeons. And what I learned is that if you have an anterolisthesis, there are very few things that you can do when it gets to be really symptomatic other than a single level fusion, because it's an anatomical displacement, right? And so you can't put an artificial disc in. And if there's no soft tissue in there, you have to bring it back into alignment. And that kind of started my journey of a lot of consults and trying to find a surgeon that I felt comfortable with, who understood the work I do, what I need to continue to do, and why it's so important. We talked, I know I consulted, I reached out to you at one point when I knew I needed to have the surgery but hadn't yet found the surgeon, and we talked about axial rotation and we talked about range of motion. And at that point we thought the problem was in the very bottom segment from L5 to S1, and it turns out that my L5 to S1 have been fused since birth. And despite that, I have really good range of motion, which was one of the moments where I was like, okay, I think this is going to be okay. Like, I've had a fused L5 to S1 and I'm doing all this stuff. And so I found out it was actually L4 to L5. And I went to 3 surgeons. One looked at a picture of me in a half split arm balance and said, yeah, I don't know why anybody would want to do that. And I can't promise you that you'll be able to do that. And I said, okay, yeah, no, fired. Went to the next guy who was absolutely delightful, but said to me, yeah, your anatomy is tricky. You have scoliosis. I came to yoga because of scoliosis so many years ago. And it's the reason that my scoliosis doesn't cause me problems. And he was like, yeah, I really don't want to mess around too much. I'm just going to lock it in place. And I said, so you're not going to pull it back into alignment? No, I'm just going to fuse it in place where it is. And I'm like, no, I'm not going to have major surgery, without some big improvement. Surgeon number 3, a yogi herself, took one look at me and said, yeah, no, let me explain something. You think you have all this range of motion at that at that level of your spine. You don't. You have very little motion there. You're compensating, and your hamstrings are very long and flexible, right? And we always tell people in yoga, like, it's your hamstrings, it's not your joints that are making you be able to fold forward. She's like, you think I'm going to give you more than you have. Well, how are you going to do that? Well, she took a pretty complicated approach. She actually did an anterior fusion. So she went in from the front, which I remember I called you back, Michelle, and I was like, oh my God, I found this surgeon and I adore her and she's got the best approach in the world, but I'm so scared because I never had abdominal surgery, right? And our core in yoga is so integral. So she went in the front and she got a really good correction without touching any of my spinal nerves. And she put a titanium disc spacer in there, which is how I got the 1/2 inch that we were just talking about a moment ago. And then she flipped me over and robotically placed 2 rods and 4 screws between smack in the middle of L4 and smack in the middle of L5. And we have imaging that we can look at in just a minute. But by doing all of that, she brought me back into alignment and she stabilized me. And something that happened when I consulted with her, she asked for a whole set of imaging that hadn't even been brought up by the other 2. One was a bone density scan, and that's super important, right? You want to make sure you have the density to build fusion. But she also did a scoliosis x-ray on me. My scoliosis had not progressed in any way. Thank you, yoga. But that same L4 that was slipped forward was also slipped over. So I was heading for like a world of pain if I didn't do this, and when I looked at that, I was like, oh, well, I think I'm shorter than I am supposed to be. And she said, oh yeah, you're going to get taller because, when your spine moves forward and over, like, you lose height. And I'm really too young to be shrinking. So a lot of things came into place with that consult.
That's amazing. I love, sort of the backstory of this. And what I think is so interesting, and I think our listeners will really enjoy, is the last cadaver lab we went to in Colorado Springs. We actually had a cadaver with the same issue. The arm had an antrolisthesis as well. And it really looked like there was just a dive down. It was just interesting. And she had osteoporosis, osteopenia. So basically, we just touched it and it completely crumbled. So
wow.
Look at those images and walk us through how this all went. And we're going to start with our first image. And this is going to be the image that shows us the original diagnosis. And so here we are. Do I have it?
That's the one. So that is the CT scan. And if you look, the first thing you might notice is that protruding spinous process.
Mhm. Right
Yep.
here.
And so that's the little bump that I told you. I'd go behind me and I would feel this little bump. So that had been there for, decades. And then of course, obviously, like I've shown this to lay people just for fun, like, and anybody who looks at this, they're like, oh, ooh, oh, that looks like oh, you have a problem. And it's like, yeah, there's a big problem there. And so what was explained to me is that, so you can see the disc height at every level in my spine is pretty darn youthful. I'm 52. So, and then L4 to L5, there's nothing left, right? It's all been kind of pushed forward in a blob, and that was removed in surgery. But then there's all that white thickening, and so and you know this really well, the lumbar spine absorbs all of the load of your spine. And so what happens is when you don't have anything left in between the discs, the body automatically starts to build more and more and more and more bone to protect you and to keep you standing. But they call that osteophytes, and osteophytes don't feel very good. So she actually trimmed quite a bit of the osteophyte, especially at L5, and she used that to create the bone fusion that would kind of lock in and go in between the two segments. And you can't really see on x-ray where it is that they fuse you. And a lot of people, including myself, like you always think of the two vertebrae, they just kind of glue together. That's really not how it works. The way a fusion works is the two facet joints at the back of the spine, those fuse first. So she's using the bony stuff from the osteophytes plus this bone morphologic stuff, like a stem cell thing that they have. And then they put it in between those facet joints and try to encourage the bones to fuse. And that process takes like 6 to 12 months, which is, I'm at 3 months right now. So I'm very, very early, and I'm very far still from being able to bend forward or twist. So my yoga practice right now is very much standing asanas, um, a lot of standing and supine, not a whole lot of twisting because I'm not supposed to do that right now. So that's the sagittal view of like sideways looking at my spine, vertebra slipped forward, painful, right?
Awesome. Yeah, no, it definitely looks painful. Let's take a look at the other view we have. So we have multiple views here,
Yep.
and it's going to show us that additional complication that Liz was talking about previously. Bear with.
And that was kind of the piece with the anterolisthesis was millimeters, right? It was like 6 point something millimeters. And I did feel like I was shrinking. And she's like, yeah, no, that. And then when we have this next image that you're going to pull up, it will all make sense.
Absolutely. So we've got it now, and here we go.
Okay. So that one that's kind of heading off to the right side, that is the same L4 vertebra, right? So it's diving forward and then off to the right. And so when I looked at that, and again, this is now October 21st, is 3 surgeons in and 3 months of discussing this and thinking about this. So when I saw that on October 21st, I kind of went, oh, yeah, I have to do this. Like, there's no more being scared about it, worried about it, apprehensive about it. I was just like, how much longer before I have a major event? Because I have zero stenosis in my spine, which is another like really nice blessing. But you don't, that was like on borrowed time. So she basically explained to me that she was going to go in anteriorly so that she didn't have to mess around with and move nerves and paraspinal muscles out of the way. Because what does she need to do now? She's got to pull all the way back into center to the midline and then all the way back.
Mm.
So it's pretty complex. And I have yet to see another person. She had another patient who had the lateral listhesis. That person had a pretty severe lumbar scoliosis. Mine is not. But that person did not have the anterolisthesis. So mine was kind of unique. And again, I was just kind of, you try to be grateful for what you can be grateful for. And so for me, I went driving home that day and I was like, well, what can I be grateful for? I can be grateful for the fact that this is all at one segment and this is still a single level fusion.
Mm.
That was my message that day.
Absolutely. Well, let's take a look at what she did in there.
Mm-hmm.
And I think I just find this so fascinating. We're going to look at that side view first.
Mm-hmm.
So
Yep.
here we have it.
Yep. So that is, I think, the day after surgery. They take pictures in surgery, and like when you're in recovery, kind of all woozy, they show you. And I remember being like super excited, even from the recovery, like, oh wow, you guys made me really straight. So,
Yeah.
but you can see the titanium spacer there.
Mhm.
Okay, so that's about 13 millimeters, which is how I grew the half an inch. So
Mm,
I went back to my normal height, which is 5'6". And you can see the screws, they're placed like very specifically at the center of both of the vertebrae to kind of grab and hold as much bone as possible. And then around the edge of the screws, at the end of the rods, that's where it's going to fuse from one facet joint to the next. And so that's what they're looking for now, is like when I go in for follow-ups, they look to see, is there evidence of bony bridging over those joints?
mhm.
So that's the sagittal view, and then you'll see the next one, the correction of the lateral listhesis.
Mm, yes, this one. And there it is.
And so that's actually shot from the front. So the screw that you see coming at you is in the back of me. And the spacer is, and she explained this to me. So if you look, the vertebrae are really well stacked, nice and even between the ball socket hip joints there. But the screws look kind of, cattywampus, and that's because the robot goes with your anatomy. And
Mm,
so the spacer isn't necessarily in the middle, but it's at the highest height that it needed to fill. That's how it was explained to me.
okay. Well, it looks like a very extensive surgery. So how
Mhm.
has the recovery been? What has it been like for you coming home and starting to move again?
Yeah, so I did a lot of work before surgery. I mean, I upped the ante on my personal practice, and I did a lot of core work, and then I did a lot of PT preparing because I had a significant sciatica on my right leg. So I had weakness in my right, and I was trying to get as even as I could before surgery. But nothing prepares you for the fact that like after surgery, so I got home and I walked the first day, like they got me out of bed. I walked the whole floor and they were pretty happy with that. Um, and then I got home and it was probably like a week because I was in the hospital 4 nights. So it was probably a week out from surgery that I woke up one night and I had like really bad, like worse than I've ever had sciatica in both legs. And I was like, okay, what is wrong? Like, and so I come to find out that when your nerves have been compressed for a really, really long time and they open up space, the nerves then sort of kind of have to find their way around. And then when they do that, they get very angry. So for like 2 weeks, I relied on heat packs to just kind of dull that nerve reawakening. So that was the worst part, and it didn't last that long. The other interesting thing is that because I grew and she shifted me back into alignment, my whole hip area had to get used to that new position. So for like the first month, I'll say, I walked in a very guarded position because I don't want to bend, I don't want to twist, I don't want to mess anything up, I don't want anybody to touch me. I had a massive bruise because of all the work that had to be done right and pulling back. So I had this big bruise that most people don't have when they have this kind of surgery. So I just was really guarded. And so that made my SI joints really hurt a lot. But then as I was able to kind of relax the body and walk normally and use my hips properly, that went away. So that's just kind of the weird stuff that they don't tell you about. And I feel like to her credit, it's not that she didn't tell me, it's that everybody's so different, and they prepare you for what they think is gonna, and actually she had told me the sciatica stuff, some people have it for like 2 months. I had it for like 2 weeks. So I was really grateful. I think a lot of that is because of all the movement that I do.
Absolutely.
Yeah.
Absolutely. Well, I'm super interested to talk a little bit more about her entry point. So she went through the front, she went
Mhm.
anteriorly into the spine. And, as somebody who's been in multiple cadaver labs, three over the last 3 years or so, I understand maybe better than most of our listeners why
Sure.
so complicated. And you had a lot of fear going into this, specifically
Mhm.
around like how it was going to impact your abdominal muscles and your core and all that stuff. And I mean, from my perspective, I just want to know like how she got underneath all of your organs. So tell us a little bit more about that.
So my understanding, because I was under for a long time, but my understanding is that so there's a vascular, whenever you do an anterior fusion, there's two surgeons, right? There's the primary surgeon who's going to be either a neurosurgeon, in my case, she was a neurosurgeon, or an orthopedic surgeon. And then there's a vascular surgeon. And so the vascular surgeon is the guy who made the incision within the first, like, I don't know, 6 weeks. Like as soon as I was cleared to go to PT, he had me doing abdominal core activation. And I'll tell you, coming back from this in terms of core, right, was easier than coming back from a second baby who gave me a little diastasis recti. So, and I think it's because he was able to, they went really low and then they retracted and then they went in and they moved the organs out of the way. So the vascular guy is there to basically move the organs and make sure that you don't have a vascular event on the table. And then I think the bulk of her time was spent in the front. I'm going to say in excess of 3 hours because my surgery was like 6.5 hours. But a lot of that is like they have to re-prep you, move all the intubation, and then flip you, right? And then re-prep you for the back. So again, it was complicated. And then the back was just one midline incision down. She opened it up, didn't really do a whole lot with the muscles, and robotically went in. On the left side, she went in through my iliac crest. So when I was healing initially, I could feel like a little bit of healing at that bone, which is an interesting feeling. It's different. Flat bones are different from not flat bones. Yeah.
Sure, sure. Well, it's just fascinating to me. I mean, not everybody has had the experience of being in a body like, some of our yoga therapists have at MVP, but having that experience and then hearing your story, it is super fascinating. I'm amazed at your recovery. You've done just such a beautiful job. I mean, how are you feeling overall?
Well, yeah, I mean, overall, I mean, initially I had a lot of fatigue. That's gone. And I just, I go to PT and other than having to watch that bending and move everything from the hips, I really am sort of back to regular activity, right? I was able to drive relatively early, like 4 or 5 weeks out. I actually will tell you, if anybody has spine surgery and you have to be the passenger, get back to driving as soon as you can, because when you're driving, your feet are in a different position. They're in front of you. You're bracing at the wheel. You can kind of anticipate bumps in the road. It's just a lot more pleasant to not be the passenger after you've had back surgery. That's the only, like the real challenge in the beginning was like, riding in the car, a lot of unpredictable. And I couldn't do that for a long, long time, but now it's getting a lot better. So yeah, I mean, I'm more looking forward to in the next 3 months getting cleared to start the bending and the twisting. Because in terms of balancing and stuff, like my core, I just got cleared to do planks. So I can come down and I can hold for a chaturanga, but I can't go to the up dog because that involves extension that I just can't do right now, for fear of messing up the fusion.
Sure.
So, and as an active, that was one of my big fears. And you and I talked about this, like I'm so active in my yoga practice. How am I going to pull back? I am so active in my teaching. So in my teaching, I'm now having to think, okay, not teaching from the mat, walking around, like, and I've been trained, to give really good auditory cues, but it's natural for a lot of us to just kind of go into the pose. And I cannot go into a triangle. That would be bad right now.
Yeah.
It's more of a mental thing.
Sure, sure. No, absolutely. Absolutely. Well, I know that you had a bunch of things. You had a lot of concerns around some of your upcoming events and teaching and your personal practice. So what does your future look like right now? You've got 3 months until you can start to bend again,
Yep.
a little bit longer until twisting. So what does the future have in store for you professionally?
Well, so I have a company called Island Girl Yoga Experience, and it's named sort of after the fact that I was born on an island. I was born in Sicily. And one of my favorite places to be, and this very restorative and healing, is St. Croix in the Virgin Islands. So I run yoga retreats in St. Croix, and I run them in Sicily as well. Um, and I also do cat rescue, which again, that revolves around a lot of bending, twisting, chasing, so 2 months from now, I'm actually going to be leading a retreat on St. Croix. Um, and I do have, so, again, not teaching from the mat and all of that interesting stuff. My surgeon actually asked me like a month and a half ago, she said, do you have anybody that, you could have as an assistant, as a model? And I thought, yeah, I do. My 18-year-old. So my 18-year-old, who's also a proficient yogi herself, but she's going to do a lot of the demos for the balancing workshops that we do. But in terms of like being present and building community like that, that's just going to come naturally. And it's funny the way things work. Like last July, and I don't really, my scoliosis is in my bio on my website, and I always mention it when people say, well, how did you come to yoga? But I don't like actively pursue a yoga for scoliosis kind of career path. But it's funny, people just show up, and a girl on my July retreat had a scoliosis, and she didn't know that I did yoga for scoliosis. And there we were in St. Croix working on alignment. I did a big alignment workshop one day, and she mentioned to me, oh, well, this doesn't feel comfortable in my body, and how can I work on? And it was just wonderful because I said to her, well, I have scoliosis, and this is how I came to yoga, and I was trained in Iyengar. And so I feel like, you never know who's going to show up on a retreat, and the right people show up who need what you have to offer, and then you learn from them too. So I will be a little limited in my, practice per se, like twisting and bending, but I don't feel like it's going to take away from the joyfulness of running the retreat. And then my next one, my Sicily retreat this year is in July. And by then I'll be like 9 months out. And I think, barring any terrible unforeseen, I'll be pretty back to normal. Because stamina wise, my energy is back finally, so.
Great. That's great. I think there's a lot to be said about the lessons you will learn not teaching on the mat. That's one of the things that, especially it depends on the community you're in, but in Austin, we have quite a few studios that won't allow their teachers to teach on the mat. They have to around. And I do a mix of the two depending on who is in class, because from accessibility perspective, some people who have ESL people in class, they don't understand the cues. I need to demo, right? So it can make things a little bit difficult when you're trying to create accessible options. But at the same time, the gift of being able to read bodies and to really learn how to read bodies because you're not on the mat, I think will really benefit you as a teacher. So and your students, I'm giving them that, really personal attention.
Yeah, because you have the time to even just in my teaching at the studio now, I'm realizing like, wow, I'm really watching and being mindful. And, I check in with people and I say, if you don't want a hands-on assist, I won't give one. But it does allow you to really take in a lot of common patterns, mistakes that people make, or just body alignment when people are finally getting to where like, oh, they feel where their body is in space. Look at the difference, so-and-so's triangle looks so much better. But yeah, the only concern that I had really was like, in terms of bringing my daughter down, is what if you get somebody who truly is a beginner and they like you say, or there's a language issue and they want to watch and see. And some people, especially when they're first starting in yoga, they want to be in that back corner, they want to watch. And so I just wanted to be mindful of that and offer it there. But I do think it's going to be, I think it's going to be great. It's a lot of fun. We still have 2 spaces on that one, by the way.
Oh, that's so much fun. Yeah, no, I think it's so neat that you get to bring your daughter as well. So what would you tell somebody? I mean, we also talked a little bit about like, there are a lot of teachers that have fusions along the spine, but nobody really talks about that. So what would you tell a yoga teacher or a yoga student, a practitioner who's being told that they need a spinal fusion? What would your message be to them?
Yeah, so thank you for mentioning that, because that was a big piece for me in this journey. So if you Google yoga instructor spinal fusion or spinal fusion advanced yoga, take your pick. There just are not people out there talking about needing this surgery. And this is a pretty common, like it's something like 12% of women that have an anterolisthesis. Now, who becomes symptomatic and all that, that's a different breakdown. But like, it just was discouraging to me. Like I might have been in the surgeon's office, a year prior if I had found someone to talk to. There's just not a lot of people out there talking about it. And in fact, what you do see, and this is kind of interesting, when you Google those things, what you find is people that are offering sequences for people with a fusion and what not to do.
Mm.
And the sequences that they're offering, because I've watched through some of them, they're like incredibly limiting, like limiting to the point where a lot of people would actually walk away and say, oh, geez, I'm going to be giving up the more profound and exciting and challenging parts of my yoga practice that really allow me to breathe and, feel like I'm accomplishing something. And it's kind of disheartening, right? And so for me, like, even my surgeon, like for her to be a yogi, and we would have conversations before surgery about like, okay, so when am I going to be able to do this? And I would do like boat on her chair, and she'd be like, well, that's boat. Well, you can't do that until I clear you with, but I mean, just the context.
Mhm.
And so that is a problem. And one of the reasons that I, reached out to you and said I wanted to do this is because there are many people like me. I'm sure there are thousands of us, and people just aren't talking about it and giving space for, don't be afraid of it. If you need it, you need it. And if you have the right team and you curate your team, I mean, I curated my team. I drive a half an hour for PT. I see a PT who's got an incredible knowledge of anatomy and understands what I do. I could go to PT down the street. I curated my surgeon. Like everything was, because it's your body and you only want to do it once and you want to end up on the other side better and stronger than you were before. But I would like to be sort of a voice of awareness out there. Like there's people doing this. And if I thought this was going to, you know, cut my yoga practice short, and it has been so beneficial to me over my life, right? Or my career short, I wouldn't have done it. So, you know, I'm living proof. And I just hope that, more people will kind of embrace the idea of, if you have, because I know there's a big yoga with scoliosis community with fusions. But a lot of people who need a fusion, if they see yoga with scoliosis, they might say, well, I don't have scoliosis, so that's not my issue. So this person doesn't have much to offer me. Um,
Yeah.
in reality, the people with scoliosis really understand the three-dimensionality of their spine, and I
Yeah.
feel totally safe with them. But yeah, there wasn't a lot out there. And like, and my surgeon, by the way, when I talked to her, I asked her, I'm like, have you had anybody else? And she said, well, you're my first yoga instructor, but I've done 6 Rockettes, scores of other professional dancers, and hockey players. And I went, okay, you're hired.
Yeah, for real. I mean, like, I totally agree with you. I think one of the interesting thing was, this is something that I would be remiss if I didn't mention it. A lot of yoga teachers don't understand anatomy. And so when
Mhm.
you, to me specifically, I told you, and the surgeon reinforced it, that you're not twisting from that place anyway.
Right.
That's what a lot of people don't understand. They think you're twisting from the lumbar. They think you're back bending from the lumbar. That's not where it's happening. It's happening in the transverse plane. It's happening
Right.
in, like, where thoracic and lumbar meet.
PL junction. Yeah. Yeah.
So you're, when you get back to the place where you are cleared to do those things because the fusion has taken, then you will have maybe even better range of motion than you had before. I'm with
This
your
is what, that
surgeon.
was the hope when because I went in for my follow-up. I think it was the first follow-up, like the 6 week or something. And the doctor said, you think you had all this range of motion between L4 and 5 because you're flexible, because you have long hamstrings, because you know how to move your body. But you really didn't have a whole lot at all. In fact, I'd venture to say that the space we created, you're going to have more. And I thought, wow, so I get to walk away a half an inch taller and no more pain. And I'm actually more mobile. Wow, okay, that works. And it's an understanding of anatomy. And I will say, as somebody who I did my 300 advanced with MVP. And the first thing I tell people is like, you know what? The way that your school teaches anatomy and you spiral it over and over and over through everything you do in curriculum and just showing the models. And it's just very, very, very It's very thorough. And for somebody who didn't have a background in science, because my 200, I really felt like I was like memorizing these joints and learning what not to do, but it was very different. I didn't have like the understanding and the be in the body that you need when you're teaching classes and you want injury prevention and you want people to feel empowered in their bodies. So that was a big piece. That's why I called you. I was like, listen, I'm having conversations with like the spine surgeon who said, I don't know how you do that and why you would want to. He actually did say, I think when you talk about your side crow, I was doing side crow in his office, and I think when you talk about that, you're not really bending where you think you're bending.
Yeah.
Well, but he couldn't articulate to me that it was the thoracic lumbar junction. Like, hello, like that's all I needed to hear.
Yeah, yeah. No, and it's interesting because I think a lot of physicians, I mean, that's one of the things I always tell yoga teachers and yoga therapists, like we're not physicians, we can't diagnose,
Right.
what we can't do. However, a lot of physicians are so specialized that they don't really, they have their understanding and their awareness in their particular specialty. And then when you try to take it outside of that specialty, or you try to lay over another another concept or context to, oh, I want to twist in this way, it's not relevant to them because they don't have that breadth of experience. So I'm really glad that you got someone who understood you and your unique needs. And I think not only is this podcast really important because we're talking about spinal fusions, we're talking about scoliosis, but also we're talking about advocating for yourself. You went to 3 different doctors, you did curate your team, and in doing that, you had the best possible outcome. And so this is just a nod and a reminder to, all of our listeners that listening to your intuition and really like tapping into inner knowing, which is a huge part of svadhyaya, a huge part of our yoga practice.
Yeah.
It's so important because if we don't do that, we're not going to be in alignment with what we truly want, and so I just want to commend you for doing that, for taking the time, because it took time, it took energy, right, to find those doctors and to find those professionals that you wanted to work with. So kudos to you, girl, for doing it. And
Thank you. And I will say that you were very much a part of my curated dream team, you and Tara. And I also worked with a yoga therapist from MVP, in the year leading up to, just around different other things going on in your life. Because if you're going to undertake major surgery and you're going to be in a vulnerable place where you need help from other people, and I'm a very independent person and I needed help from others, and basic just ambulating around the house in the beginning, you have to engage in some self-care before, during, and after, right? Not just the after, but like the before is just as important. The mindset that you go into with it. I had never ever had major surgery in my life, let alone go under anesthesia for 6 hours and 19 minutes. So if I can do this, anybody who needs it can do it. So, and I do want to say I am available if anybody wants to reach out and chat. If you visit my website, www.islandgirlyogaexperience.com, my contact information is there. And if you just want to chat about an individual issue, like, I'm more than happy to share, because I just feel like there needs to be more awareness, and nobody should forego their yoga practice. There's just so many benefits to yoga in daily life. Nobody should forego it or be nervous or be scared. I have a retreat attendant who called me. She has osteoporosis. I had a yoga instructor tell me that I shouldn't be rolling up from supine to a seat because I have osteoporosis. And I said, well, let's have a talk about that, and it's like she got this fear at a studio that she had been going to for like years. And
yeah,
it's just,
well,
there's nothing wrong with being careful and cautious. But when you start to project your own concerns, you really mess with somebody's mind.
Oh, absolutely. I mean, that's a whole other podcast, my friend. That is like, I mean, I have heard some yoga teachers say some really interesting things, and it's like, and I think I've mentioned this to you, that I've heard teachers, students will come out of class and they'll be like, oh, my lower back hurts, and the teacher, without imaging, without any diagnostics, will say, oh, that's SI dysfunction. I don't even know what they're talking about, because there's no way to diagnose that just because somebody says that my low back hurts. It's not even within our scope of work. So I definitely think that there's a lot of fear out there that then perpetuates these misunderstandings about the body and about the anatomy and our range of motion and what we can and can't do. And again, I'm just really grateful to you that you took the leap and that you're sharing your story. And definitely those of you who are listening, if you do have questions, I've known Liz for a long time, and she's been on retreat with us, and I plan on going on retreat with her. And so definitely reach out to her, as she's a wealth of information and knowledge, and an excellent at fostering community. So we're so glad to have you.
Well, thank you for having me. Thank you
Thank you
for
so
having me. I know you
much.
have a broad audience and it's a very diverse audience. And I know that, the right people will hear this message and here's another just a little pointer, right? As somebody who spends a lot of time in the Virgin Islands where the healthcare system is not great. When I told people on St. Croix, I got to go up to Boston to get major surgery on my back, my point being, if you have to travel to find the doctor that you feel comfortable with, who has the approach that you need, they kind of looked at me like, yeah, of course you do. It's like, that's what people do when they need specialty care. They go to the best person for the job. So, don't be afraid to look around. There's a lot of spine surgeons, and there's a lot of information online, and a lot of it is really scary. So, you know, don't be afraid to reach out.
Oh, well, thank you so much for being here, Liz. Again, y'all check out Liz's website. Give it to us one more time, Liz.
www.islandgirlyogaexperience.com.
Awesome. And like Liz said, she's got a retreat coming up in St. Croix and one in Sicily. Yeah.
Yep. April and July.
Oh, fun.
And I have some 2026 stuff up there too, but right now the priority is on sort of completing our communities for the first two in 2025.
Well, I'm excited about that. I'm even looking at the Sicily one myself. So definitely check her out. And if you do have any spinal issues or questions, or any questions about fusions in general, feel free to reach out to Liz. She's a great resource for you. Thank you, Liz, for being here.
Thank you, Michelle.